Empty chair technique, Gestalt therapy in action. Welcome to this presentation on the empty chair technique, a powerful intervention in Gestalt therapy. In this session, we'll explore what the technique is, its origins, how it works, and its therapeutic benefits. We'll also look at practical steps, examples, and ethical considerations for applying it effectively. The empty chair technique helps clients express thoughts and emotions they have been holding back, often toward someone who is not present, or toward a part of themselves they struggle to acknowledge. It offers a safe, structured way to bring these feelings into the open, so they can be processed and resolved. We'll move step by step, starting with its theoretical foundation, then demonstrating how it's applied in real therapy sessions. Along the way, we'll discuss adaptations for individual counseling, couples therapy, group settings, and even coaching. By the end of this session, you will understand both the theory and the practice of the empty chair technique, and you'll be able to apply it in a way that is both safe for the client and effective for their personal growth.
What is the empty chair technique? The empty chair technique is a therapeutic role-play method that allows clients to externalize their thoughts and feelings by addressing an imaginary person or part of themselves. This imagined figure is placed in an empty chair across from the client, creating a symbolic presence. The client speaks openly to the figure, expressing what they have never said, or could never say, in real life. This could be directed toward a parent, partner, friend, colleague, or even a deceased loved one. In some cases, the other is a part of the client's own psyche, such as their inner critic, inner child, or a conflicted side of their personality. After speaking, the client may physically switch chairs and take on the role of that imagined figure, responding to their own statements. This two-way dialogue often reveals hidden emotions, unmet needs, and new perspectives. The technique can be surprisingly emotional and deeply revealing, even though it is essentially an imagined conversation. Its power lies in making the invisible visible, giving voice to what is normally silent or repressed. Origins in Gestalt therapy. The empty chair technique was developed by Fritz Perls, the founder of Gestalt therapy, in the mid-20th century. Gestalt therapy emphasizes the here and now, self-awareness, and integration of different parts of the self. It holds that unfinished emotional business from the past can block present growth. Perls believed that awareness and acceptance of these unresolved feelings could restore psychological wholeness. The empty chair became one of his signature methods for facilitating this process. In Gestalt practice, the empty chair serves as a concrete focus for abstract or avoided feelings. Speaking to an imagined person in the chair anchors the client in the present moment while still addressing the emotional residue of past events. The method quickly gained popularity beyond Gestalt therapy. Today, it is used by therapists from many orientations, including humanistic, integrative, and even cognitive behavioral frameworks. Its adaptability and experiential nature make it appealing to a wide range of practitioners.
Core purpose. The empty chair technique serves three main purposes: awareness, emotional expression, and resolution. First, it brings hidden or avoided emotions into conscious awareness. Clients often carry unspoken feelings for years: anger, grief, guilt, or love that was never expressed. This exercise makes those emotions visible and real. Second, it provides a safe outlet for emotional expression. Clients can speak freely without fear of damaging a real relationship or being interrupted. This release can be cathartic, helping to relieve emotional tension. Third, it allows for resolution. By engaging in dialogue, even with an imagined figure, clients can gain new understanding, release resentment, forgive, or find closure. Sometimes they uncover insights about the other person's perspective, or they finally acknowledge their own needs and boundaries. The ultimate aim is integration, bringing together the different parts of the self and resolving internal conflicts so the client can move forward with greater emotional freedom. How it works. Basic process. The empty chair technique follows a straightforward process. The therapist invites the client to imagine someone or some part of themselves in the empty chair. They are encouraged to speak directly and openly, using I statements to own their feelings. Next, the client switches chairs and speaks as the imagined figure. This shift allows them to step into the other perspective, often leading to surprising insights. For example, someone confronting their critical inner voice might discover that it is rooted in fear or a desire to protect. After several exchanges, the therapist guides the client to reflect on what emerged. They might explore what feelings were strongest, what new understanding was gained, and how this insight can be applied in real life. Although simple in structure, the process can evoke intense emotions. Therefore, the therapist must create a safe environment, monitor the client's emotional state, and provide grounding if needed. When to use it, this technique is particularly useful for resolving interpersonal conflicts that remain unresolved, processing grief or loss when closure was never achieved, addressing self-critical or self-defeating inner dialogue, healing trauma by expressing suppressed emotions, working through difficult decisions by exploring both sides internally. It is most effective when the client is emotionally ready to engage in imaginative work and has some trust in the therapist. It should not be used when a client is in acute crisis or too emotionally fragile to manage intense feelings. In coaching or personal development, it can help individuals prepare for difficult conversations, clarify personal boundaries, or understand motivations from multiple perspectives. Essentially, it is valuable anytime there is unfinished business, feelings or conversations that have been avoided but still exert a strong emotional pull on the client's present life.
The therapist's role is crucial in creating a safe, supportive environment. They introduce and explain the technique clearly, ensuring the client understands the purpose and process. During the exercise, therapists monitor emotional reactions, provide grounding if needed, and encourage the client to stay present with their feelings. They may prompt deeper exploration or help the client pause if emotions become overwhelming. After the dialogue, therapists facilitate reflection to help the client integrate insights. The therapist balances holding space for emotion with gentle guidance to maintain safety and therapeutic progress.
Benefits: the empty chair technique offers multiple benefits. It promotes emotional release, allowing clients to express feelings they might otherwise suppress. This release can reduce anxiety, depression, and stress. It also fosters insight by helping clients view situations from different perspectives. This broadened understanding can improve empathy and reduce interpersonal tension. Moreover, the technique often brings closure to unresolved emotional issues. Clients may forgive, set boundaries, or make peace with past events, freeing themselves to move forward. Finally, practicing difficult conversations in a safe space increases confidence and communication skills. Example scenario: consider a client plagued by a harsh inner critic that constantly undermines their self-esteem. In therapy, the client places this inner voice in the empty chair. First, they express how painful and exhausting the criticism feels, venting frustration and sadness. Then, switching chairs, they speak as the critic, revealing that it stems from fear of failure and a desire to protect. This dialogue allows the client to understand the critic's intent while asserting their own worth, paving the way toward self-compassion. Such examples highlight how the technique can transform internal conflicts into constructive conversations.
Step-by-step demonstration. Step 1 involves arranging two chairs facing each other. The therapist explains the process and helps the client identify who or what will be represented in the empty chair. Step 2 is the client's open expression of thoughts and feelings toward the imagined presence. Step 3 has the client physically switch chairs to respond from that other perspective. Step 4 focuses on exploring emotions and thoughts that arise during the dialogue. Finally, Step 5 is a reflective discussion with the therapist about insights and implications for the client's life. This clear structure helps keep the session focused and therapeutic.
Common challenges: clients may initially feel awkward talking to an empty chair or doubt the exercise's value. Normalizing this discomfort and encouraging openness helps. Emotional overwhelm can also occur when confronting painful topics. Therapists must be ready to pause, provide grounding techniques, or slow the pace to protect the client's well-being. Some clients resist switching roles or find it hard to embody the other perspective. Gentle encouragement and reassurance can ease this difficulty. Flexibility and attunement to client needs are key to overcoming these challenges. Adaptations. The empty chair technique is adaptable beyond individual therapy. In group settings, participants may engage in dialogues that foster empathy and shared understanding. In coaching, it helps clients rehearse challenging conversations or explore conflicting goals. For personal growth, journaling or visualization exercises inspired by the technique can be effective substitutes when physical chairs aren't available. Such adaptations broaden the technique's reach, making it accessible in varied contexts.
Ethical considerations. Ethical practice requires ensuring clients' informed consent before using the technique. Therapists must assess emotional readiness to engage with potentially intense material. Providing post-session support is crucial, especially if difficult emotions emerge. It's important not to use the empty chair technique with clients in acute crisis or those lacking sufficient coping resources. Respecting clients' boundaries and pacing the process responsibly uphold professional and ethical standards.
Key takeaways. The empty chair technique offers a safe, structured way for clients to voice thoughts and feelings that might otherwise remain hidden. By embodying both sides of a conversation, whether with others or parts of themselves, clients deepen understanding, release pent-up emotions, and move toward healing and resolution. This experiential process integrates fragmented emotions, supports self-awareness, and often leads to meaningful change. In summary, the empty chair technique is a versatile and powerful therapeutic tool. Whether used in counseling, coaching, or personal growth, it transforms silence into dialogue and conflict into clarity. With practice and care, therapists and clients alike can harness this method to foster insight, emotional release, and empowerment. Fragmented emotions supports self-awareness, and often leads to meaningful change.
Thank you for watching. Share your answer in the comments, and don't forget to like and subscribe for more videos like this one.